Hello guys, today we'll be talking about typhoid fever and we'll be talking about typhoid fever under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is typhoid fever? Typhoid fever is a systemic, life-threatening infectious disease that is caused by the bacterium Salmonella typhi. Typhoid fever is transmitted via ingestion of food or water contaminated with the feces or urine of infected individuals or chronic carriers. Typhoid fever is a major public health problem, particularly in areas with inadequate sanitation, poor hygiene practices, and unsafe drinking water. Clinically, typhoid fever is characterized by prolonged fever, abdominal discomfort, headache, malaise, and in severe cases can lead to intestinal perforation, hemorrhage, as well as death. Despite advancements in antimicrobial therapy as well as vaccine development, typhoid fever still poses significant challenge due to emergence and spread of multi-drug resistant and extensive drug-resistant strains of Salmonella typhi. The disease, typhoid fever, disproportionately affects young children and young adults, leading to intense morbidity, mortality, and economic burden. Understanding the causative agent, epidemiology, mechanism of disease, prevention of disease plays important role in controlling and curbing the disease typhoid fever. Let's talk about causative agents. The causative agent of typhoid fever is Salmonella typhi. Salmonella typhi is the causative agent of typhoid fever. Salmonella typhi is a gram-negative, non-spore-forming, facultatively anaerobic organism. It is gram-negative because it takes up the reddish-pinkish stain color of the secondary dye, usually safranin or neutral red, in gram staining procedure. It is non-spore forming because it doesn't produce spore, it doesn't sporulate. It is facultatively anaerobic because it can survive or thrive in the presence or absence of oxygen. And it is motile because it can move. And its motility is due to the presence of a peritrichous flagella. So you have the bacterium to be this, and then this is the peritrichous flagella. The peritrichous flagella is responsible and enhances the motility of Salmonella typhi. Salmonella typhi belongs to a family of bacteria known as the Enterobacteriaceae. Hmm. Enterobacteriaceae. Okay, this is the family of bacteria that Salmonella typhi belongs to. Salmonella typhi is strictly a human pathogen, and humans are the only known natural reservoir of Salmonella typhi. Salmonella typhi possesses certain virulent factor that it uses to propagate its pathogenicity. Some of these virulent factors include the V1, the V1, the VI rather, the VI capsular polysaccharide antigen. The VI capsular polysaccharide antigen is one of the major virulent factor of Salmonella typhi. And this virulent factor, the VI capsular polysaccharide antigen, enables Salmonella typhi to evade phagocytosis and complement mediated killing, thus enabling Salmonella typhi to survive and carry out its activity within the host. There's also lipopolysaccharides. Lipopolysaccharide contribute immensely to the endotoxic effect of Salmonella typhi. Although the presence of type 3 secretion system, type 3 secretion system. The type 3 secretion system is another very important virulent factor of Salmonella typhi. And the type 3 secretion system enables Salmonella typhi to invade and survive within the host cells, thus enabling pathogenesis. Unlike other non-typhoidal Salmonella species, Salmonella typhi is adapted for systemic illnesses and rather than just localized gastroenteritis. Let's briefly talk about the pathogenesis of Salmonella typhi. Let's talk about the pathogenesis of Salmonella typhi. The pathogenesis of Salmonella typhi begins when Salmonella typhi enters into the stomach. Usually, Salmonella typhi, as well as other organisms, are not able to survive within the stomach due to gastric activity. But certain conditions reduce the gastric activity, enabling survival of organisms, in this case, Salmonella typhi, within the stomach. Such conditions include aclohydria, malnutrition, use of protein pump inhibitors, such as omeprazole, and use of antacids. These reduce the gastric activity of the stomach, enabling Salmonella typhi to survive within the stomach. Once Salmonella typhi survives within the stomach, it penetrates and enters into the small intestine. In the small intestine, Salmonella typhi adheres and invades the intestinal epithelium of the small intestine. The invasion of the small intestine by the Salmonella typhi triggers the immune system to release macrophages. The macrophages are then released into the small intestine and they engulf the Salmonella typhi, the bacteria within the small intestine, but they are not able to neutralize and phagocytize the bacteria due to the presence of the VI capsular polysaccharide antigen that we earlier talked about. Due to the presence of the VI capsular polysaccharide antigen, the macrophages are not able to neutralize and completely phagocytize the bacterium Salmonella typhi. And so the Salmonella typhi survives within the macrophages, and not just survives, but also multiplies within the macrophages. The infected macrophages then are transported into the mesenteric lymph nodes. Mesenteric lymph nodes. The infected macrophages with the bacteria in them are transported into the mesenteric lymph nodes. In the mesenteric lymph nodes, the bacteria is then transported into the bloodstream, and this is known as the primary bacteremia. When the bacteria, this is primary bacteremia. Primary bacteremia occurs when the bacteria within the mesenteric lymph nodes are released into the bloodstream. In the bloodstream, the bacteria is deposited within several organs, including the liver, the spleen, including the bone marrows, as well as the gallbladder. Within these organs, Salmonella typhi undergoes intracellular multiplication and replication, and it is then released back into the bloodstream, leading to secondary bacteremia. Leading to secondary bacteremia. It is very important to note that it is during the secondary bacteremia that the clinical signs and manifestation of typhoid fever begins or commences. It is also very important to note that the bacteria that enters into the gallbladder, infects the bile within the gallbladder, infects the bile that is stored within the gallbladder. And this bile, when it is released into the intestinal tract, further reinfects the intestinal tract, causing inflammation, hyperplasia, necrosis, and ulceration of the Peyer's patches. Severe complications also arise in this phase, such as intestinal perforation, as well as hemorrhage. Chronic carriage may also develop during this phase due to persistent stay of bacteria in gallbladder, and this is particularly seen in individuals that have gallstones. So this is basically about the pathogenesis of typhoid fever.